Good afternoon. Can I get everyone's attention, please? May I have everyone's attention? Please, just for 1 second. If you can hear my voice, turn around and tell someone else that I'm speaking, and then we'll have a ripple effect. Great, great. I want to welcome you all for our annual Homer G. Phillips Public Health Lecture. It's going out. Okay, it's going in and out. I want to welcome you all to our Homer G. Phillips lecture series. Before we start, we really want to recognize all of you for coming here in person for this august moment. And we want to recognize all the people who were so instrumental in creating this, creating the overall focus of the program, bringing in the memorialization of Helen Nash and Homer Nash. You're going to learn about so much in a few more minutes. But before we get started, we want to show you a kind of a mock-up of what will be installed on the right outside of this building. Actually, I'm sorry, right outside of that building, this building on the wall, and it'll be there for eternity to really recognize the accomplishments of the entire Nash family. And so I have, okay, sorry. Okay, I have Mayor Tishaura Jones here with me, with Dean David Perlmutter, and we want to reveal this plaque, which you will be able to see and take great pictures of when it's actually out on the building. And so if you can just get on either side, Mayor, here, and ready? Yeah. All right, here we go. So, do we show this one? Okay, one more picture here. Okay, so we have a couple of our older persons here, and I will invite them up to take some pictures and really commend them on actually drafting the resolutions for Dr. Helen Nash and Dr. Homer Nash. And so Alderwoman Peel, Hubbard, if you can just please step up also. All right, we're so glad. Thank you for everything. Thank you for the proclamations. And we'll just take a group picture. And please enjoy yourself selves for the next 10 minutes. We'll convene in the main auditorium promptly at 6 and begin the program. There are hors d'oeuvres on either side of the room, so please take advantage of those, meet your friends, and we will start at 6 p.m. Thank you. Good afternoon, almost evening. It's actually good evening then. It is just a pleasure to see this auditorium fill with those of all of us who really revere the Homer G. Phillips Hospital and the remarkable legacy of the hospital and the people who traverse that remarkable institution. I'm Dr. Will Ross, Associate Dean for Diversity here at Washington University School of Medicine. And it is my pleasure to welcome you to our 26th annual Homer G. Phillips Public Health Lecture. When we, 26 years ago, conceived this, we were ushered on by just a remarkable group of ladies and men who were part of the Homer G. Phillips Nurses Auxiliary. They've been with us for 26 years and they're here. And I want those Homer G. Phillips nursing alumni to stand up and receive your due. They truly are the flag bearers of the city, of this region, and have maintained that history through tremendous effort, which continues to this day, as many of you are quite aware. Before we start, I want to just recognizing that this past week was Indigenous Peoples Day. I think it's important that we pay homage to the true ancestors of this country. So in honor of Native Indigenous American Indians, we want to read our First Nations land acknowledgement. We begin by acknowledging that we gather today on the ancestral lands of the Osage, the Miami, and the Sioux peoples who were removed unjustly, and that we in this community are the beneficiaries of that removal. We honor them as we live, work, and study here at Washington University School of Medicine. I also want to acknowledge that this is a particularly important time and occasion for the university as we're engaging in our strategic plan for the future. And part of that plan is highlighted here in this statement, Washington University here and next, our shared vision for Washington University's next decade. You'll see here our strategic vision. We will mobilize research, education, and patient care to establish WashU and St. Louis as a global hub for transformative solutions, and hear this, to the deepest societal challenges. We have them here in this city now, in this region, and this is quite a statement from Washington University, from our leaders, from our Chancellor and our Dean, and so many others who are been shepherding this plan. So now it's just my pleasure to really talk about our occasion, why we're here and what we hope to do. You certainly know that we've been doing this for 26 years and you're aware of the history of the Homer G. Phillips Society, the Homer G. Phillips Hospital, which really was constructed at a time when people of color were restricted to living in a certain area and for accessing care in a certain hospital. We know that during that time period, from the inception of Homer G. Phillips Hospital in 1937 to the closing of Homer G. Phillips Hospital in 1979, a remarkable group of people were involved. Some of the nation's top physicians. Between that time period, 1 out of 3 African-American physicians in this country were trained at Homer G. Phillips Hospital. Quite remarkable statistic. Many of those we've memorialized many of those individuals here in this room. I can't remember, I won't quote all the names. You've heard some of them. James Whitaco, Frank Richards, LaSalle Lafall, Howard Venable, Walter Washington, there's so many others. And now you're going to hear about this legendary, thank you. You're going to hear about this legendary family, the Nashes. We're going to learn a lot about the history of this hospital, evidenced by these individuals who walk those halls, who share their prodigious knowledge of medicine and care for so many people in the Ville neighborhood and throughout. I've already recognized the Harmon J. Phillips Nursing Auxiliary, who've labored just tirelessly to keep this tradition alive. And I just want to also recognize what I've learned from those nurses and from all the physicians, the nurses, all the auxiliary health professionals at that hospital. So now it's my honor to introduce our dean, Dr. David Perlmutter. Dr. Perlmutter is a Spencer T. and Alan W. Olin Distinguished Professor and Executive Vice Chancellor for Medical Affairs, and Carol Bauer Endowed Dean of Washington University School of Medicine. He is a member of the National Academy of Medicine and the American Academy of Arts and Sciences, and past president of the Society of Pediatric Research, and past member of the Advisory Council of the National Institute of Digestive and Diabetes and Kidney Disease. Prior to his current position, he was a distinguished professor and chair of the Department of Pediatrics at Children's Hospital of Pittsburgh. Dr. Perlmutter is known internationally for his research, remarkable in the characterization of alpha-1 antitrypsin deficiency, a genetic disorder which is associated with accumulation of a misfolded protein, which can cause severe liver disease. Dr. Perlmutter has not only accelerated medical school's preeminence in biomedical research, and I dare say NIH funding as Senate, as far as anyone could ever imagine, and we're not there yet. Number one is right at the doorstep. And he has continued to promote clinical translational research, public health research, and population health research, while advancing diversity and inclusion on our campus and extending our engagement with the community. So it's my pleasure and honor to bring up Dr. Perlmutter.
It's really an honor for me to welcome all of you today to this wonderful event where we are going to talk about public health. And it seems so right after what we have been through these past 3 years that we talk and celebrate some of the wonderful things about this city and public health. We are fortunate to have the Honorable Tishaura Jones, the mayor of the city of St. Louis. Thank you, Mayor Jones, for being with us today. I also have a whole slew of people here, really wonderful to be with us. From the city of St. Louis, we have Alderwoman Tina Peel of the city's 17th Ward, who sponsored and co-sponsored the legislation to rename Children's Place as Nash Way. We have Alderwoman Shamim Clark Hubbard of the 26th Ward, who co-sponsored the Nash Way ordinance. And I also want to mention that both Alderwoman Peel and Alderwoman Clark Hubbard sponsored resolutions adopted by the Board of Aldermen last spring honoring Helen and Homer Nash, and copies of those resolutions are in your program. And we really are deeply grateful to both Alderwomen for their efforts in this area. Other members of the Board of Aldermen who are with us tonight include Bill Stevens of the 12th Ward and Alderwoman Laura Keyes of the 21st Ward. And we are delighted also to welcome the Director of Health for the city, Dr. Matty Davis. Let's give a round of applause for them. I also want to thank for being here some of our WashU and BJC leaders who are here today. We have Andy Newman from the Board of Trustees of Washington University and his wife Peggy. We have Dr. John Lynch, president of, I know he's here. I'm looking around for John, president of Barnes Jewish Hospital. Trish Lollo, president of St. Louis Children's Hospital. And I also want to acknowledge Dr. Gary Silverman, who's in the back, chair of the Department of Pediatrics. This, of course, is the home department of the Nash family. And we also are very, very excited to have Dr. Alison Nash with us today, representing the family. And I don't know if I've seen him here today representing our good neighbors next door, Dr. David Allen, president of the University of Health Sciences and Pharmacy. David, there you are. Thank you so much. I know there are many others I may have missed, but we are just so glad that all of you are able to be with us this evening. And this is an evening for celebration. And so I'm going to give a little bit more remarks than I usually do. Please bear with me. This lecture series is named in honor of the historic Homer G. Phillips Hospital, which achieved national acclaim for its high quality of care and served as a premier training ground for African-American medical and health professionals. It was one of the most prominent hospitals in the country for Black doctors and nurses, and it was an anchor for the local community at a time of segregation and inequitable access to healthcare. The hospital also had a strong relationship with Washington University School of Medicine, and we are proud to carry on its vital work of ensuring the highest quality of care for anyone in this community. And as you know, Dr. Donald Suggs, who we're so happy is here to give the keynote, is a product of that relationship, having completed his postgraduate work at Washington University Dental School and Homer G. Phillips Hospital. We are so fortunate to have Dr. Suggs here speaking to us on this day when we honor another absolute pillar in our community. I have had the privilege of serving with Dr. Suggs on various boards over the past few years and have learned about his wisdom and how people listen carefully when he speaks. Today, we are also celebrating the renaming of a portion of Children's Place at the heart of our medical campus in honor of the Nash family, whose legacy continues to define and distinguish pediatric care in St. Louis. Dr. Helen Nash and Dr. Homer Nash Jr. both understood that there were children in the community who would not have access to the same resources other area children did, and they dedicated themselves to caring for those most vulnerable. They both served on the clinical faculty at WashU. Helen was actually one of the first 4 African-American faculty members and took an active role in training future doctors. Homer's daughter, Dr. Alison Nash, mentors children from the St. Louis Public Schools who are interested in medicine, and as medical director of Healthy Kids Express, sends mobile asthma and dental care, hearing and vision tests, and screening for lead poisoning and anemia well into the community. Care for the community runs through the veins of this family. Nash Way will honor them and remind all of us of how seriously we must take our roles as healthcare providers, how much we owe our community, and how far we still have to go to ensure equitable access to healthcare and opportunity. I have long been humbled to be involved in pediatric care in this city where the Nash family made and continues to make such an immense contribution. And so I feel a deep responsibility to change the narrative of this city and our school, to continually work towards becoming a more diverse and inclusive community. In 2017, School of Medicine leadership committed to increasing our underrepresented faculty, and we are already exceeding our 10-year goal in year 5. In 2018, we hired Dr. Cherie Wilson as our inaugural Associate Vice Chancellor and Associate Dean for Diversity, Equity, and Inclusion to spearhead initiatives across our school. That year, we committed $100 million to renewal of our curriculum for the medical school and scholarships for incoming medical students. And this year, 39% of our first-year medical students are from populations that have been underrepresented in medicine historically. And I just want to acknowledge Dr. Eva Agard and Dr. Valerie Ratz, who are here with us tonight and who have really championed this accomplishment. We also know that to create an equitable and inclusive climate, we must commit to addressing and eradicating racism. And so in 2021, the school committed to and approved an anti-racism training curriculum and are implementing that philosophy and that culture across the campus under the leadership of Dr. Wilson and Dr. Ross and Dr. Agard. We still have a long way to go, but I am inspired and we are inspired by the Nash legacy and by the legacy of Homer G. Phillips Hospital to work harder every day to get to where we need to be. Now it is my honor to formally introduce Mayor Tishaura Jones. Mayor Jones was sworn in as the 47th mayor and the first Black female mayor in the city's history on April 20th, 2021. And I just heard from her. It's been a year and a half and she's been busy. She was elected treasurer of St. Louis in 2012, a position she held until becoming mayor, and served 2 terms in the Missouri House of Representatives, including serving as the assistant minority floor leader. She is the first Black female to serve in all of these key leadership roles. Mayor Jones has a bachelor's degree in finance from Hampton University and a master's degree in health administration from the St. Louis University School of Public Health. A graduate of the Executives in State and Local Government program at Harvard University's Kennedy School of Government. In her tenure as treasurer, she launched the Office of Financial Empowerment to help St. Louisans make better financial choices, as OFE's College Kids program has helped over 18,000 public school students start saving through educational savings account with over $1.5 million saved to date. Mayor Jones, thank you so much for being here with us tonight to celebrate the Nash family and their contributions.
Good evening. It is such an honor to be here with you on this wonderful occasion to celebrate St. Louis's own medical royalty, Doctors Homer and Helen Nash. And I have to admit that all of my friends are probably patients at the Nashes, but I wasn't, so I'm a little jealous right now. And, you know, St. Louis has a rich history of training and building up Black doctors and nurses, as we heard Dr. Perlmutter say earlier, or about our legacy hospital, Homer G. Phillips Hospital, the first Black hospital west of the Mississippi that not only trained doctors and nurses for the city, not only for our country, but across the world. And the Nashes were a critical part and continue in that legacy. Dr. Helen Nash, you already know, before becoming the first African-American woman to join the attending staff at Children's Hospital, did her residency there. And after he got a Purple Heart and a Bronze Star, Dr. Homer Nash joined his sister in training at Homer G and was on the staff of Children's and Barnes Jewish Hospitals. And their legacy continues on through their daughter, Dr. Alison Nash, who also continues her work at Children's. I want to thank Alderwomen Peel and Hubbard for sponsoring the renaming of this street. And I just think it's going to be really wonderful to have that plaque outside of the building so others can learn what many of us know in the Black community and have known for so many years, that the Nashes are our own medical sheroes and heroes. And thank you. And because of my education and training in health administration at St. Louis University and public health, it's personal for me to make sure that as we move this administration forward, and as we move the city forward, that we not only take care of our economic development, but our development in health as well, as witnessed earlier this week when we announced the formation of a brand new behavioral health bureau at the city's Department of Health under Dr. Mati Davis. And the last point I'm going to make is, as we also move forward and we look forward to having an unprecedented amount of resources at our fingertips through the American Rescue Plan, the infrastructure law, the Inflation Reduction Act, it's going to be my mission to make sure that we put those dollars to good use to rebuild our communities. Because when I drive around Sumner High School and Homer G. Phillips Hospital and the Ville neighborhood, I remember the stories that my father and my grandmother told me about what the neighborhood used to be. And Dr. Nash and I were having a conversation earlier about the community, that accidental community that used to happen in our neighborhoods as we were growing up, that when you would get home from school, somebody else would be coming home that was a doctor or a lawyer, or in that accidental mentorship that happened in our blocks. We can recreate that. We can recreate that in our city. And it's my mission to not only to empower our city, but to develop and transform St. Louis into a new city on the horizon. So I thank all of you for joining us today for this wondrous occasion. I'm just like over the moon happy that now everybody gets to know who the Nashes really are. Again, our medical royalty, and it'll be out there for everybody to see for decades to come. Thank you for coming, and God bless.
Thank you, Mayor Jones. Next, I want to introduce Trish Lollo, representing Barnes-Jewish Christian Medical Center. As president of St. Louis Children's Hospital, Trish Lollo. I shouldn't, first names sometimes come easily. She's responsible for successful operation of this over 300-bed pediatric hospital that has provided exceptional care for children for more than 130 years. With its academic partner, Washington University School of Medicine, Children's is consistently ranked among the nation's best pediatric hospitals by U.S. News and World Report. It has provided care for children in all 50 states and 80 countries around the world. A member of BJC Healthcare, St. Louis Children's Hospital follows one simple mission: to do what's right for kids. Trish Lollo previously served as president of Barnes-Jewish West County Hospital. During her 3-year tenure, she led the hospital's long-term strategic plan and campus transformation. So I'm really delighted to know that she has stepped up with her leadership, having had extensive service as vice president of oncology at the Siteman Cancer Center. She led strategic planning and operations for inpatient outpatient services at the Siteman Center. And she's also fostered multidisciplinary care efforts within clinical programs and played a vital role in increasing Siteman's national presence. So please, happy and acknowledging Trish Lollo.
Thank you, Dr. Ross. Thank you for organizing and hosting tonight's events and lecture. And thank you to Mayor Jones and all of our elected officials and leaders from Washington University School of Medicine and BJC Healthcare for joining us this evening on a very exciting evening. And Dr. Suggs, we look forward to your lecture. Most of all, we are thrilled to have Dr. Alison Nash and so many members of the Nash family here with us tonight, representing the impact and legacy of Dr. Helen Nash and Dr. Homer Nash. They have had an enormous contribution for our patients and our entire community. As Will mentioned, I am honored to serve as president of St. Louis Children's Hospital, where Dr. Helen Nash broke barriers as the first African-American woman to join our attending staff. And then during her 40 years of service, including as president of our medical staff, Dr. Nash also looked to the future, mentoring other physicians and establishing scholarships for students interested in medicine. When Dr. Homer Nash joined the medical staff in 1955, he saw the opportunity for exceptional and equitable care, extending beyond the walls of the hospital. For decades, he committed himself to providing care to children in North St. Louis, reaching out to underserved and often overlooked neighborhoods. Both doctors, Helen Nash and Homer Nash, have been awarded for their many accomplishments the St. Louis Children's Hospital Distinguished Service Award. Through their skill and passion, Dr. Helen Nash and Dr. Homer Nash embodied many of the same values our organization emphasizes today: compassion, respect, and excellence. And this commitment and these values are alive and well at BJC Healthcare and at St. Louis Children's Hospital through our Office of Community Health Improvement and our Child Health Advocacy and Outreach programs, where we are working to develop new partnerships to address social determinants of health and eliminate the health disparities that have long plagued our region. That's why for me tonight is not only about reflecting on our past and being honest about where we've come from as a hospital, as a medical campus, and as a society, and celebrating those who paved the way for others. Tonight is also an opportunity to reinforce the commitment to our values, which drive us to create a true sense of belonging for every patient who turns to us, every one of their family members, and every care provider who works passionately to fulfill our mission. It will be through that sense of belonging that we're able to build trust with those who we are proud to serve. And when trust is present, when every connection is filled with love and authenticity, our community will be healthier for it. Thank you to the Nash family for leading us on this journey, and thank you to each of and every one of you for being on this journey with us. Well,
It is next my honor to introduce my esteemed colleague and close friend, Dr. Alison C. Nash, who will be speaking on behalf of the Nash family. They all assembled. They're really wonderful people. They're just looking forward to all the comments. Dr. Nash attended Howard University in Washington, D.C. She then attended Baylor College of Medicine and entered the United States Navy as an ensign. During her 11 years of service, she completed pediatric residency training at Naval Hospital, Oakland, California, and served as the director of the pediatric clinic there, the Naval Station Treasure Island, at Naval Station Treasure Island, and was staff pediatrician at Naval Hospital, Okinawa, Japan, and attained the rank of lieutenant commander. Quite remarkable. Upon completion of service in the U.S. Navy, Dr. Nash joined her father, Dr. Homer Nash's pediatric practice, which was established in 1955 and located in North St. Louis. She has been in pediatric practice in St. Louis and a member of the medical staff of St. Louis Children's Hospital since 1989. Dr. Nash, as you heard earlier from the dean, is also a preceptor for our community outpatient practice experience, which provides primary care training for St. Louis Children's Hospital pediatric residents since 1994. She served as president of the medical staff from 2007 to 2009 and president and she served as president-elect during that time and served as president from 2009 to 2011. Dr. Nash served as community physician representative on the Executive Faculty Council of Washington University School of Medicine from 2012 to 2014. In 2014, Dr. Nash was appointed medical director of Healthy Kids Express, a community outreach program of St. Louis Children's Hospital and BJC. Please honor Dr. Nash.
Thank you all. Thank you. Thank you. So this has been a wonderful day. And as you've heard all of the history of Dad and Aunt Helen, and I want to share that their father, Homer Sr., was actually a physician in World War I. And went to Meharry Medical School, and I'd like to think he must have been about 12 years old when he went there. But, and so, you know, people ask, say, well, how did you, out of all the sisters, you know, end up in medicine? And I'm not really sure, but, you know, we all grew up surrounded by that. And what I will say is that Dad and Helen were really the most kind of perfect mentors for life and pediatric medicine. I learned a lot in school. I learned a lot in my military experience. But when I came back to St. Louis and worked with Dad for those 20 years before he retired, I mean, that's where I learned the art of medicine, how to connect with people, and you know, just how important it is to be of the community that you're caring for. It's just so important. So I've been really, really fortunate that along the way I've had so much support from family, from community here, from my office staff who, you know, Dad was a visionary. He hired the first nurse practitioner back in the 70s, and Diane, I don't know if she said, Diane Smith, pediatric nurse practitioner. And I have another nurse practitioner, Andrea Molden, who works with me, has been with me for 12 years. The medical assistants and other office staff have been with us for 15 and 20 years. And so a lot of it again is within our office, it's family. And we're hoping that that sense of family we're sharing with the patients who trust us, you know, to care for them. So I'm just grateful. I'm grateful to be able to continue the legacy and for the confidence that the community has in me and in our office. So thank you.
What a wonderful person. What a wonderful family. We owe you so much for all your kindness and for delivering Alison to speak on your behalf. I know she spoke according to your thoughts and wishes. Well, next we will hear from our keynote speaker. No one in here hasn't heard of Dr. Donald Suggs. Come on. Dr. Suggs is an icon. He's an icon locally and nationally. And he has transformed this region with his remarkable insight, his ability to galvanize people around a common mission, the strength of his ideas, and the ability to put those ideas into action is nothing but just remarkable. Dr. Suggs was born in East Chicago, Indiana, where he attended public schools. He graduated, as you heard earlier, a bachelor's degree and a doctor of dental surgery from Indiana, and then from Washington University School of Dental Medicine. He then came to Washington University, thank goodness. He came to St. Louis, thank goodness, for an internship in 1957 in a medical residency later at the historic Homer G. Phillips Hospital. Dr. Suggs said he chose Homer G. Phillips Hospital as a training program because he loved the idea of seeing so many African Americans in authority positions. He served as chief of oral surgery at Dover Air Force Base in Delaware, and was the first African American to serve as associate clinical professor at St. Louis University School of Dentistry. He was a fellow of the American Association of Oral and Maxillofacial Surgeons and maintained a limited practice in dental and dentistry before retiring in 2011. Here's a part that many of us don't know about Dr. Suggs. He was highly active in the civil rights movement. He was in the 1960s into 1970s, he actually served as chair of the Poor People's March in Washington, DC in 1968. Quite remarkable, quite an accomplishment. He also is quite the Renaissance man, and we all know that. He is steeped in philosophy and art history. I've learned just as much from those areas as I have from medicine, from Dr. Suggs. He was a long-term president of the Alexander Suggs Gallery of African Art based in St. Louis and New York. He's a founding member of the Center for African Art, now the Museum of African Art in New York City, and is a former member of the board of directors of the Studio Museum in New York as well. And here in St. Louis, Dr. Suggs serves on the St. Louis Museum, Art Museum Board of Commissioners and its collection committee. Now, Dr. Suggs has more awards. We will actually probably spend another hour and a half if I read the awards, and so we don't want to do that. We'll just skip through a few. He was awarded an honorary doctorate of humane letters from Washington University in 2012. He served on the board of numerous institutions, including the Barnes George Goforth School of Nursing, the Collegiate School of Medicine and Bioscience. Yay, collegiate. Sorry, I got that. I had to get that in there. Harris Stowe University, the Muni, Opera Theater St. Louis, Regional Business Council, the St. Louis Symphony Orchestra, Urban League, Washington University George Warren Brown School of Social Work, and the National Council. He was named Citizen of the Year in St. Louis in 2004. What a remarkable person, what a remarkable career. Dr. Suggs.
Thanks for that overly generous introduction. I wish my kids could be here to hear it. But they're in New York. My son is ironically is having I didn't plan to say this, but you know, I'm a proud father, so they're naming a street after him in New York City. And of course, that's where I was going to be this evening, except the specialness of this evening, my high regard for the Nashes, and as a family, we decided that I should come to speak. And so before my brief scripted remarks, I want you to indulge me for a moment as an elder, because as we get older, three things happen. The first is your memory goes. I can't remember the other two. But first, seriously, I want to first acknowledge all the dignitaries here this evening and thank those responsible for giving me this opportunity, affording me this opportunity to speak on this momentous occasion, commemorating the beloved, respected Nash family and their notable achievements. This is a highly significant and proud moment. I'm deeply honored and humbled to have this opportunity to share some reflections about these remarkable physicians, as well as some of the obstacles they faced in their life journey. Dr. Helen Nash and Dr. Homer Nash Jr. are among the most highly regarded and esteemed Black physicians in the pantheon of pioneering Black physicians. Both of these Atlanta natives came to St. Louis for training at Homer Phillips Hospital and chose, to our good fortune, to remain in St. Louis. It's very appropriate that we also honor Alison today because she has followed in her father and uncle's trailblazing footsteps in St. Louis. And I also want to express my profound respect and appreciation for Dr. Will Ross. Dr. Ross, who among so many of his important achievements, has been a tireless champion for 26 years of these Homer G. Phillips lectures. These lectures, sponsored by the Washington University Medical School's Office of Diversity, Equity, and Inclusion, help keep the valuable memory of this historic institution and its impact on Black St. Louis and beyond alive. I also want to acknowledge Doctors David Perlmutter and Gary Silverman for their role in this renaming project and their powerful, strikingly introspective testimony to the importance of the contribution of these pioneering pediatricians, and point out that Washington University's Medical Center's commitment to a permanent timeline about their institution's evolution toward diversity, inclusion, and cultural responsiveness to all patients. This timeline will be shown in a prominent public corridor here on campus. We should also praise these two leaders for their forthrightness in admitting some early shameful truths in some of the past policies and practices at this medical center. It is commendable to see these locally based world-class medical institutions led by the prestigious Washington University School of Medicine respond to the aggregate, to the loud calls from community leaders over the years for racial justice, either by fostering it or simply operating as exemplars for a better way. Although it's no longer enforced by law, racial segregation remains a fundamental part of the social order and political economy of this country. So this strong commitment to follow the wise path of community leaders who have urged this over the years is welcome news. They join some other of their peer institutions in the country who have promised that their acceptance of a needed reckoning regarding structural and systemic inequities rooted in racism and discrimination will lead to future reconciliation informed by truth. This acceptance could lead to a broad, broad institutional reform, change that is more fair, equitable, and lasting. So it's heartening to see this mea culpa, an acknowledgement of having done wrong, rather than following a path of misinformation, denial, hollow protests, like some school boards and opportunistic politicians who have been willing to acknowledge past institutional racism and how it promotes divisiveness and hampers a more inclusive and equitable future. This is difficult work. Deniers of historical truth want to ignore or erase the criminal damages caused by 4 centuries of structural racism. Complaining that it's too uncomfortable, they don't want people to hear about the historic systemic constraints of race in this country. Moreover, in this age of overturned precedents by the overbearing and ideological current United States Supreme Court, we must remember 1896, Plessy versus Ferguson, that ruling upheld the constitutionality of racial segregation, and it was not overturned until 1954. We dare not go backwards again. When we speak about those who practice in the magnificent profession of medicine, we want to be certain to hear from some of the most magnanimous, erudite, and compassionate voices in the profession. It's in the spirit of this dedication and empathy that we honor the Nashes today, because they lived and worked according to medicine's lofty ideals. They practiced with the sacred credo of service to others. I would like to cite at this point some thoughts of the esteemed late Dr. Paul Farmer, Dr. Farmer passed away this last February at age 63. Was a professor at Harvard Medical School. He said he believed in the sacredness in every single person and rejected the notion that some lives matter less, and that he operated within the belief that injustices lead to poverty and sickness, and that health is a human right, and no human is less deserving of that right than another. Dr. Carl B. Moore, who's a distinguished chair, former chair of the Department of Medicine here at Washington University Medical School of Medicine, remarked to his colleagues, "Those of us in medicine enjoy the great good fortune of being surrounded by opportunities to be helpful as physicians or as teachers or as investigators." I speak about the two elder Nashes who embraced all three of these roles and instilled those values in Alison. They were exceptional individuals who lived and worked in their communities, while also helping force the reckoning that we speak about today. That is the extreme disparities in healthcare in St. Louis. They saw some of the denial that most of these disparities were based on racism, not race. They were determined to help provide more high quality care and greater access for their patients and others who suffered from these disparities. But even as they gained prominence and acceptance for themselves in the broader medical community in St. Louis, the Nashes remained steadfast in their commitment to addressing the continuing needs of their patients in North St. Louis. Without dismissing or ignoring some of the admittedly past ignominious racist practices here at the Washington University Medical Center, it must also be said that in that same period, many of this institution, some of the institutions here, most accomplished and celebrated physicians did become quite involved individually. Their principal involvement was instrumental, for instance, in creating an unprecedented relationship with Homer G. Phillips Hospital, a relationship that eventually led to improved clinical patient care, superior training for interns, residents, and allied healthcare professionals. This collaboration helped to enhance the hospital's reputation and standing nationally. The relationship between these stellar physicians from this medical center and their counterparts at Homer G. Phillips started modestly, but in time evolved in one of mutual respect and later some genuine collegiality. I wish I had more time to cite specifically some of the more inspiring examples of those relationships, but I expect we'll see many of them featured in the planned timeline exhibition here on campus. During much of the era of the senior Nashes, Black physicians were looked up to rightfully as beloved paragons of erudition, competence, empathy, who also worked, lived, and worshiped in the community. They engendered a strong sense of pride in a largely marginalized and underserved community. It is similar to how most Black people respond today when they see an authentically brilliant Justice Ketanji Brown Jackson in contrast to Clarence Thomas on the United States Supreme Court. To see her affirmation of self, proudly and unapologetically Black. But I won't, and I shouldn't get much more deep into race and politics on this upbeat, auspicious occasion today. Since much has been spoken about today about these exceptionally smart, courageous, truly magnificent medical icons, I will share my remaining remarks with some of my more personal experiences. Although I knew Dr. Helen Nash primarily through social encounters, she had a well-known professional reputation for her impatience and low tolerance for incompetence, indifference, or lack of respect shown toward any patient. She was feisty in an age of segregation and relatively few women physicians. According to Dr. Michael DeBond, who's a former patient of Dr. Nash, she inspired him to become a physician and pediatrician. He says, this is what he said, these are his words, she was very staunch in her commitment to doing what was right, particularly for underserved children. She did what was right, even when others were bashful or reluctant. She refused to compromise her principles and was up to the consequences of her actions and resolutions. Now, I got to know Dr. Homer Nash Jr. especially well over the years because in addition to his being my three children's pediatrician, fortuitously, our offices in the same building on North Kings Highway were the first ones open in the morning in the building. And it was always enjoyable and informative for me to have conversations with him, despite a clear mismatch when we had differing opinions. Although I was several years younger, he was undoubtedly had a huge advantage over me in IQ. Nevertheless, the exchange with this sharp, forward-thinking, well-informed, intellectually curious person who's also a handball and bridge enthusiast was always interesting and stimulating, no matter the subject. Homer always acted independently according to his convictions. My respect and high regard for him, his contributions, my respect then and now are unequivocal and deeply felt. The community has the good fortune, however, to see his yeoman's work continue with a very talented and able physician, his daughter, Alison. But in closing, we must move past structural racism deniers, the ends-driven leaders who want us to ignore the truth revealed by evidence. This medical center's leaders have chosen to speak out, embrace some good ideas, but moving forward offers real hope in these difficult days when so many things give us little hope. This dedication of Nash Way today is a reminder that the ideals of medicine realized stand firmly on the side of social justice. Thank you very much. Thank you for keeping, I want to thank the leaders of these institutions for keeping the legacy of this remarkable family alive for the ages. Thank you.